Right. Equipment and safety in patient's room. Want to make sure that you provide the patient with privacy. And first and foremost, they are entitled to their privacy. I'm saying it countless times now. Man, just put yourself in their situation. All right. Here we see um, the healthcare worker closing the curtain so that no one else in the room can see what's going on. Make certain all specimen collection supplies, needles, and equipment are properly disposed of or returned to specimen collection tray after blood collection. Check on position of bed rails. You want to make sure that the bed rails are in the proper position that they need to be in. Are they up? Are they down? Um, where do we need them to be to get this to be able to collect this specimen? Check for food or liquid spilled on the floor. Avoid contact with electrical instruments. Report possible problems immediately to the nursing station. Healthcare workers should be careful not to travel too quickly from one room to another and around corners. Items lying on the floor, such as flower petals, should be cleaned up. And I've said this before. You just want to make sure that you be mindful of that because when we're transporting specimen, there are a number of things that could happen. Right? I could bump into someone at the nurse's station. I could sit something down because I realized that I failed to label my specimens at the patient's bedside. So I had two specimens in my hand. I put one down. As I'm writing on the other one, someone comes in unknowingly and knocks the other one over. Um, there's a number of things that can happen. So we want to make sure that again that we're always in compliance, following the rules to avoid these things from happening at all costs. Something as simple as a rose petal being on the floor could put you at risk for a slip and fall. Right? Be aware of any allergies or latex products the patient or healthcare worker may have. We'll discuss in more in detail. I believe it's like chapter 10 when we officially start talking about how to perform venipuncture, the questions that you're supposed to ask. But you always want to make sure that your patients don't have um, are not allergic to latex or any adhesives that we may be using prior to us performing venipuncture. All right, maybe we see the latex-free cart. See that it's labeled right there. It says it's latex-free. This is a latex safe environment. Door must be remain closed. Check for latex contents or products and equipment before entering. Symptoms of allergic reaction to latex: skin rash, hives, facial swelling, nasal, eyes, or sinus irritation, sometimes shock. Please see the table on table 5.2 in your textbooks. Um, that table shows you things that contain latex. You have your IV tubing, gloves, tourniquets, and etc. All these things contain latex, so you want to make sure that you be mindful of them. Some places only use latex free. Some places um, may use both. All right, well they should use both. So you want to make sure that you are aware of these things. Um, or what other procedures they have in place in the event that they don't have supplies, and this is an issue for a patient. All right, healthcare institutions must be disaster ready in case of a hurricane, flooding, earthquake, bomb threat, and other disasters. Healthcare workers should be familiar with disaster preparedness procedures. All right, since disaster plans and phone noted there out in the open for everyone to read. Which allows for easy access. And make sure that you again know these are and use them accordingly. Bleeding aid. Severe bleeding from an open wound can be controlled by applying pressure directly over the wound. Use standard precaution from exposure to blood and other potential infectious materials. Use your PPE. A clean handkerchief or other clean cloth or compress should be placed over the wound before applying pressure by the gloved hand. Okay? In the emergency in which a clean cloth is not available, the gloved hand should be used until a cloth compress can be located. Okay? Bleeding of a limb can be decreased by elevation. Okay? Get that leg elevated up above the heart. Start slowing down the blood from the blood flow. Um, Actually, the best way to prevent someone from bleeding out is packing the sites, if at all, if that can be done. It's best to pack the site to minimize the the amount of blood lost. The injured portion should be raised above the level of the victim's heart unless the injured portion is broken. Even with elevation, however, the pressure should be maintained on the wound until medical assistance arrives. A tourniquet should not be used to control bleeding except for an amputated, mangled, or crushed arm or leg, or for profuse bleeding that cannot be stopped otherwise. Okay, you know, I want to just because someone is bleeding, you don't want to just go put a tourniquet on it because that could not help. And you want to make sure that you assess the situation and act accordingly. Healthcare workers must know techniques of basic CPR. Hey, you all are CPR certified prior to you all coming into the classroom. Right? If there is no response, call out for help and um, start aid. Place victim on his or her back. Open the airway passages. Okay? This is how we perform CPR. If there is no response, call out for help and then start aid. Okay? Someone's around. If you don't have your cell phone, if you have your cell phone, call first. Still call out for further assistance, and then you want to start aid. You want to make sure that you get the victim on their back, open their airways before you start applying, and be mindful of this because you will see this again. Okay. You see here, his nurse is like she's checking to see if this person is conscious. She's appears to be shaking him by the shoulder. If there's no breathing, maintain the head tilt, chin lift, and pinch the victim's nose. Show with your fingers. Blow into the victim's mouth by giving one slow breath with enough volume. Produce a visible chest raise. See her here. She is holding his head back. She's tilting his chin up. She's listening to see. She's listening to see if she hears anything. See if she feels any air coming out. Right? She places her mask over the victim's face, and she is going to administer her a slow breath to providing enough air to cause the chest cavity to raise or inflate rather. Give enough full ventilation if first one Give another full ventilation if first one did not lead to raising of the victim's chest. If this does not start an air exchange, reposition head and try again. Again, look, listen, feel for breathing. Okay? Again, be mindful. Be conscious of doing all of this while we're administering CPR. Okay? Because there could be a lot going on, so you want to make sure that you are in the moment listening so that you can hear that person, if that person is breathing. Reasons for shock include a severe injury, bleeding, excessive burns, insufficient oxygen, other traumatic events, um, early signs of shock, things that you look for to indicate that the patient is or going into shock. Um, Pale, cold, clammy skin, weakness, rapid pulse, increased shallow breathing rates, frequently nauseous, nausea and vomiting. Correct 6 actions for shock prevention. Correct cause of shock if possible. Control the bleeding. Because if your body is bleeding out, you're gonna get cold because the blood is what's keeping the body warm. So if you're losing blood, your body's gonna get cold, and that'll send you into shock. Um, and keep the victim laying down. Keep the victim's airways open. If the victim turn his head to the side so that the neck is anchored. If they vomit, turn the head to the side so that the neck is anchored. Okay. In the absence of broken bones, evaluate victim's leg so that the head is lower than the trunk of the body. Keep the victim warm. Call for emergency assistance. Actions not recommended include giving fluid to victims who have an ambulatory injury. Person is likely to require surgery or general anesthetic. Giving fluids to an unconscious or semi-conscious person. Definitely don't want to do that because that could lead to them choking. Right? So again, we make sure that we practice all these steps, being mindful of our surroundings, so that we can provide the best health possible for our patients.